Good evening, you are tuning into AWANI Tonight with me, Farhana Sheikh. Recent spike exhausted private hospitals' capacity for COVID-19 patients. And IPT students allowed to travel interstate. What other concerns? That's coming up. The surge in daily COVID-19 new cases has caused private hospitals in the Klang Valley area to reach full capacity. Association of Private Hospitals Malaysia President Datuk Dr. Kuljit Singh said the biggest fear right now is for us to face a healthcare shutdown due to limited availability of beds and oxygen treatment for the patients.
The private hospitals in Klang Valley, at this current moment, we have been reaching full capacity, both the COVID-designated wards and also the COVID ICUs that we are utilizing for this condition. So we hope we can have a mechanism whereby we can actually take the non-COVID patients from the public hospitals so that the public hospitals will have more capacity to treat COVID patients. That will be one solution moving forward should the numbers increase.
Kuljit added that he hopes Malaysians would take the message of bed and manpower shortages in hospitals as a reminder of the importance for the public to remain vigilant in curbing the spread of the virus.
Institutions of higher learning or IPT students staying at campus are allowed to travel interstate to return to their kampung for the Hari Raya holidays. The Ministry of Higher Education announced today that the National Security Council has agreed for these students to be given the choice to return from May 7 to 12. Now, with the recent surge in COVID-19 cases in the country, how best do we avoid clusters from emerging with this eminent movement? Professor at the Faculty of Medicine, University Malaya, Professor Dr. Rosmawati Muhammad weighs in.
So when we talked about this balik kampung, there is this reminder that there's still an ongoing ban on the mass gathering. And this must continue because the risk of spreading to the loved ones, particularly in the elderly, in the case of balik kampung, as it is, are very real. So the question is how best to avoid these clusters from emerging. So really, it has to boil down to adhering to all the comprehensive do-all approach. But in addition, this is probably the best time for us to remind ourselves that these things must continue for some time, and what we need to have differently to avoid the clusters emerging in future is getting the COVID-19 vaccines to the level to achieve herd immunity. But this will take some time still, and this will probably take at least till early next year before we reach 70 to 80% herd immunity. But this is a must, and we must make sure that we have every opportunity to actually try to achieve this with the vaccines. And this is the cornerstone in tackling the pandemic.
Rosmawati stressed the importance and responsibility of those travelling to adhere to the standard operating procedures at all times. She said this is important due to high risk of infection while travelling as well as during gatherings which usually take place during the Hari Raya celebrations.
So one of the measures that we know would work is masking. And mask is one of the key measures to suppress the transmission, and it has been shown to save lives. So mask should be used as part of the what WHO call the comprehensive do-it-all approach, including the physical distancing, avoiding crowded, closed and confined settings. You must have good ventilation as much as possible. And of course, washing hands, covering sneezes and coughs. So these are some of the things that must be stressed over and over again, because responsible behavior in adhering to all these measures is required of everyone at all times.
The government has stressed that it is committed to making it possible for those aged 18 to vote soon. Minister in the Prime Minister's Department in charge of Parliament and Law, Datuk Seri Taqiyuddin Hassan, said this commitment was discussed and confirmed at yesterday's Cabinet meeting. Taqiyuddin said this showed that the government was committed to allowing youths aged 18 to become voters in the 15th general election and any by-elections or state elections. Taqiyuddin said the government is confident that EC is always ready to manage the election process in terms of logistics, human resources and adapting to the standard operating procedure required under the new normal following the COVID-19 pandemic in the country. On March 25th this year, EC announced that automatic voter registration and eligibility to vote on reaching 18 years of age can only be implemented after September 1st next year due to constraints faced by it as a result of the enforcement of the Movement Control Order to curb COVID-19. Malaysia Airlines will be among the first global airlines to conduct trials on the International Air Transport Association (IATA) Travel Pass, a mobile app that allows passengers to verify their COVID-19 test results and vaccination status. The trial will involve passengers on flights from Kuala Lumpur to London between April 29 and May 27, 2021. Selected passengers travelling on the MH4 flight tomorrow will be the first in Malaysia to have access to the new app. For a start, only passengers with Apple iOS devices will have access to the pilot program. Passengers will still be required to present their physical documents at check-in at this stage of the program, as per government and airline requirements. In preparation for its own digital travel health pass on the Malaysian Airlines mobile app, the airline said the app is the next step in its journey to reintroduce safe and secure travel. We'll take a short break. Stay with us.
Data pencuba hentikan induknya adalah Melayu.
Balik kepada support system. This is orang yang membuat polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita sudah tentu dia akan datang daripada pemimpin wanita.
Perang COVID-19 masih belum berakhir. Dalam kita berusaha memutuskan rantaian wabak ini, kita jangan terpedaya dengan virus maklumat palsu. Simak fakta melalui www.astroawani.com atau aplikasi Astro Awani. Teruskan berdisiplin, ratakan lengkungan pandemik ini.
The third wave of COVID-19 has taken us by storm. There's no room to take anything lightly. Everyone must follow all the steps to stop the spread of COVID-19. Social distancing, face masks, follow these steps, this SOP with the utmost discipline. Together, we can flatten the curve.
Welcome back. US President Joe Biden delivered his State of the Union address to about 200 members of Congress, the military and his cabinet. He outlined an optimistic vision after a year racked by a deadly virus in America and abroad, which includes an ambitious $1.8 trillion plan for families, children and students. Biden said that United States is on the move again 100 days after he took office. He argued that a new spending and tax credit package, which together with an earlier infrastructure and job plan, totaling around $4 trillion is a once-in-a-generation investment vital to America's future. The new proposal includes $1 trillion in spending on education and childcare over 10 years, and $800 billion in tax credits aimed at middle-income and low-income families. It also includes $200 billion for free universal preschool and $109 billion for free community college regardless of income for 2 years. Thailand converted Bangkok's Suvarnabhumi International Airport into a COVID-19 vaccination centre. This effort was made to accelerate the country's immunization program, which has seen a slow progress since it began in early March. This week, the unusually quiet airport saw long queues at the check-in area, with medical practitioners and tables occupying the area that was turned into vaccine administration points. According to a report by BBC, Thailand's vaccination rate is 1.6 doses per 100 people, as compared to 69.2 per 100 people in the United Kingdom, of which both have a similar population number. The government procured the AstraZeneca COVID-19 vaccines to cover up 90% of the vaccines to be administered to the population, despite the use of the Oxford-made vaccine being halted in various countries due to rare blood clot concerns. Meanwhile, Thailand struggles with a more severe second wave, reporting over 2,000 cases daily. Prime Minister Prayut Chan-o-cha said last weekend that more than 1,400 COVID-19 patients were waiting to be administered into hospitals. Biotechnology company BioNTech is expecting results from trials for COVID-19 vaccine in babies as young as 6 months old by September. Company CEO Ugur Zain said that it will take about 4 to 6 weeks for them to evaluate the data. Zahin told German magazine Spiegel that the first result for 5 to 12-year-olds will be available in July, while results for younger children are expected in September. He added that as soon as the data is evaluated, the company will submit the application for approval of the vaccine for all children in the respective age group in different countries. BioNTech and Pfizer have asked US regulators this month to approve emergency use of their vaccine for adolescents aged between 12 to 15 years old. Currently, their two-shot vaccine is already authorized for use in those aged 16 and above. Unidentified attackers launched assaults on 2 Myanmar air bases today, with blasts reported at one base and record fire seen on another. The attacks came after 3 months of turmoil in Myanmar triggered by a February 1st military coup. In the first attack, 3 blasts went off at an airbase near the central town of Magwe in the early hours. Later, 5 rockets were fired at one of the country's main air bases at Mektila to the northeast of Magwe, while no claim of responsibility or any confirmation of casualties were reported. Fighting also intensified between the military and ethnic minority Karen insurgents in the east, with more airstrikes sending villagers fleeing into neighbouring Thailand. The Southeast Asian country faced crackdowns since the junta took power and ousted elected leader Aung San Suu Kyi, which caused unrest civilians to hold almost daily demonstrations against the military rule. The army used lethal forces and had killed some 750 protesters in demonstrations held across the country. The Tokyo Olympics Organizing Committee is now prepared to hold the Summer Games without spectators as the COVID-19 pandemic continues to rage in the country. The committee has agreed to make the final decision on the number of spectators allowed in by June as they closely monitor the situation on the ground. While organizers have already decided to bar overseas spectators, Committee President Seiko Hashimoto said it will be extremely difficult to stage the Olympics and Paralympics in front of full crowds if the current COVID-19 situation in Japan does not improve. To ensure the safety of the Games, the organizers will require athletes and close contacts to be tested every day, while all participants must have 2 negative tests before arrival. Though Japan has not suffered as badly from the COVID-19 pandemic, media polls have shown that many Japanese people are not in favor of hosting the Games this summer, following a 1-year postponement. 2 recent polls give us contrasting snapshots of current political sentiment. What can the numbers tell us about the future? Tonight on Consider This, we speak to our panelists about interpreting the results more adequately. That is all we have for you on AWANI tonight. Get the latest news update on COVID-19 and COVID-19 vaccines from astroawani.com and Astro AWANI app. I'm Farhana Sheikh. We'll see you again.